and thanks for coming to spfinsurance.com. Today we're going to talk about the 4 key things you need to know about health insurance plans in order to make it easy for you to compare all plans and make a fast decision regarding what's the right plan for you. You see, there's a ton of different benefits that each plan offers, but there's really 4 key areas that affect pretty much everybody, and all of the rest of the benefits affect just 1 or 2% of the rest of the population. So, the 4 key areas of a health insurance plan are
The office visit copays, the deductible amount, the out-of-pocket maximum, and the prescription benefits.
so if we look at the office copayments, right now in the marketplace there are 0, 2, 3, 5, and unlimited office visit plans. So obviously, if you go with a plan that has 0 office visits, you're going to pay a lot less than a plan that has unlimited office visits. However, all preventive visits, for preventive services like an annual physical, mammograms, pap smears, PSA tests, those types of tests and visits are all free. So they don't count as one of your office visits. So you're really looking at if you have something that's wrong and you need to get a diagnosis from a doctor. That's considered an office visit. So how many office visits do you typically use in a given year is one of the key questions to determine what type of plan is best for you. The next one is the deductible amount. So in the individual marketplace, HMO plans are very expensive, so we're really not going to cover those. PPO plans, or preferred provider organizations, are what the majority of people will use. And PPO plans all have deductibles. So the deductible is the amount that, other than office visits, that's the amount that you're required to pay if you go to the hospital or have specific lab tests that are run for diagnostic purposes. You're responsible for the deductible amount. Okay? So let's say you go to the hospital because you've been hit by a car. Hopefully that doesn't happen, but if that were to happen and you had a $2,000 deductible, you would pay the first $2,000 and then the insurance company would start paying at that point in time. Now, hopefully that's clear. The next portion of it is what is the out-of-pocket maximum or maximum out-of-pocket for the health insurance plan. All plans have this cap, and that's the cap at which at any given point in time during the year where you reach that maximum out-of-pocket limit, the insurance company begins paying 100% after that. So for example, if you have that $2,000 deductible and you're in the hospital, once you hit the deductible, the insurance company will start paying some percentage of the total costs, and you'll pay a small percentage. So let's say your plan has a 20 or 30% copayment or co-insurance. The insurance company then will pay the other 70 to 80% of all benefits you receive once you reach the deductible amount. When you reach the point in time where you've hit that cap, that maximum out of pocket, at that point in time, the insurance company will pay 100% thereafter. So the last part of a good health insurance plan is the prescription benefits. There's 3 kinds of plans: those that offer no benefits at all, those that offer generic only benefits, and those that offer both generic and brand name prescription benefits. Now, obviously, we live in a world where doctors prescribe a lot of medications, but the reality is that there's a lot of medications that have been around for years in the generic marketplace that are just as good as the brand name prescriptions. So what I recommend most people do is get a plan that has at least generic coverage. But if you know you have brand name prescriptions that you need to get refilled, then look at a plan that offers brand name prescription benefits. So those are the 4 key parts of any health insurance plan. So when you're comparing one plan to the next, just look at those 4 components and pretty much forget about everything else. And that will help simplify the process. I hope this has been enlightening for you and makes things a little bit easier. If you have any questions, feel free to give us a call at 858-613-3628. Take care, and we'll talk to you again soon. Bye now.